Well, the history of aneurysm repair is very interesting from a historical surgical standpoint, if you wish. Einstein, for instance, everybody knows who Einstein is. Well, guess what? He died of a ruptured aneurysm, although his physicians knew that he had an aneurysm, and this is in the 50s. And at that time, how they thought that they were treating the aneurysm was by wrapping it, making an open surgical incision, getting to the aneurysm, and then wrap it with cellophane. And the thought in those days was that by wrapping it, it may prevent the aneurysm from further expanding and rupturing. But of course it didn't work, because 2 years after that procedure, Einstein did succumb of an aneurysm rupture. Then the technical and the surgical technique evolved very quickly. Vascular surgeons then became very proficient in the 60s and the 70s treating aneurysms with a graft. The graft is actually a piece of synthetic material that is sewn below the kidney arteries. The aneurysm is surgically resected, so it's taken away, and a graft is sewn in its place so that the blood now circulates through the surgically placed graft, and the aneurysm is no longer present. So it's a very, very good procedure that surgeons have been performing for many, many years with great success. Now, of course, there are patients who may not be good candidates for a surgical repair because of their cardiac history or because of other comorbidities. And in those patients, it became very evident that if we could come up with a lesser invasive method to actually fix the aneurysm, that would be really a great accomplishment in the history of aneurysm treatment over the past 50 years. And in the late 80s, early 90s, with the technological development of stents, it became very intuitive that stent technology and graft technology were combined together, and together we could actually create a graft which could be inserted not through a major incision, but could be inserted via tubes under X-ray guidance to the level of the aneurysm, creating less trauma to the patient and repairing the aneurysm.